breaking news, COVID-19 cases increasing dramatically in South Africa. The latest numbers are in nationally. 26,976 new infections recorded. Gauteng making up the most of that with over 8,000, KwaZulu-Natal at almost 6,000 and the Western Cape reporting almost 4,500 new cases. The positivity rate is standing at 32.2%. 54 new deaths have been recorded. But the Gauteng Premier reckons we have actually reached our peak already. Meanwhile, the UK has decided to introduce booster jabs sooner than 6 months, and it's also lifted that travel ban to South Africa, as you well know by now. For more on all of this, I'm joined by Professor Shabir Madhi with Wits University Vaccinologist, joining us from Johannesburg. Prof, thanks for your time. Always a pleasure. I want to talk first about the Gauteng Premier saying that we've reached our peak. It seems pretty soon compared to the third wave. Is he correct, especially given the latest figures?
Good evening, Sean. Thanks. So he probably is correct. The 7-day rolling average has plateaued over the past few days. And certainly this peak has come much sooner than previously. With the previous waves, it took about 8 weeks before we reached the peak. But at the same time, the material conditions are very different this time around. Firstly, Omicron is much more transmissible than any of the other variants, and that probably has contributed to us reaching a peak sooner rather than later. In addition to which, another important factor is the extent of population immunity, which probably is bringing about some level of disruption as to the extent of transmission. So I think those things coupled has resulted in us pretty much peaking much sooner than was the case in the past. So things do look...
Sorry, carry on.
So things do look promising in Gauteng, but as you alluded to, for the rest of the provinces that are somewhat behind in this current wave, you're probably going to continue seeing an increase in number of cases across the country, and not just the eastern, not just KwaZulu-Natal and the Western Cape, but all other parts of the country as well, at least for the next 2 to 3 weeks.
So it's definitely a good sign that we're seeing the peak in Gauteng, which was the first hotspot, sooner than we did in the third wave, right? But as you mentioned, other provinces are seeing numbers increase. And as we get into domestic travel in South Africa during this festive season, it's likely to increase even further, isn't it?
Irrespective of domestic travel, it's still likely to increase because the virus has already seeded across the country. So imposing any sort of restrictions on domestic travel simply wouldn't achieve anything. I think another important thing about Gauteng is that the complete uncoupling of number of infections and a death rate. So as an example, during the course of the Delta variant, when there were 20,000 cases that were being reported, the number of deaths that were being recorded in South Africa each day were between 250 and 300. This time round is 10 times less than what it was in the case of the Delta variant. So we've seen this complete uncoupling of infections and severe disease. And for me, that is the most important aspect of what we're currently observing, rather than just keeping an eye on the number of cases, which you can expect, as we mentioned before, to go into the 30 and 40,000s over the course of the next few weeks. But there's no reason to panic unless there's an increase in hospitalization.
So, Prof, let me bring in what the WHO said after, that report by Discovery Health about the virus possibly being mild, given the research they've seen. The WHO is saying that it is spreading at an unprecedented rate, and it's wrong to think that it's only causing mild disease. Would you agree with that?
Well, it certainly does cause severe disease, but to a much lesser extent than any of the other variants. And that is not because the virus is less virulent. But like I said, there are material changes in the conditions on the ground with regard to the extent of population immunity. So even though Omicron is antibody evasive, there's another important arm of the immune system which probably plays a more important role in preventing progression of infection to severe disease, as well as limiting the amount of virus that actually eventually replicates in an individual. And that is known as the T-cell immunity, or the cytotoxic T-cell responses. And that arm of the immune system is relatively conserved, despite the mutations that have occurred in Omicron. So it is really the T-cell immunity which is really bringing about this uncoupling of infection and severe disease. And that T-cell immunity is both from vaccination as well as from past infection. And our most recent serious survey in Gauteng strongly indicates that 73% of people and as high as 80% of people above the age of 50, they've actually been infected with the virus over the course of the first 3 waves, and that has induced substantial amount of T-cell immunity. So it's not about the virus being less virulent, but rather because of the extent of immunity that prevails now compared with what was present in the first, second, and the third wave.
And then you put into play the research about Pfizer vaccines versus Johnson & Johnson. We heard lots about that this week. What's your assessment of those findings?
Yeah, I think the Pfizer vaccine data pretty much corroborates what I'm saying, in that we know this virus is very antibody evasive, and not just in South Africa. There was another study that's come out from the UK, which demonstrates a similar thing, in that the Pfizer vaccine, as well as 2 doses of the AstraZeneca vaccine, don't protect against mild infection. But what the South African data shows is this uncoupling, or despite the vaccine not protecting against infection, is protecting against severe disease. The 70%, I think, is actually an underestimate, because I think the design of the study might actually lend itself to artificially bringing that estimate down. So it might well be above 70% in protection against severe disease, against hospitalization. And this is analogous to what we experienced with the beta variant and AstraZeneca vaccine, which I keep on harping on, is that despite the vaccine not having prevented infection and mild to moderate COVID-19 in South Africa due to the beta variant, the same vaccine had 80% protection against severe disease and death in a study in Canada due to the beta and the gamma variant. So what this data are telling us is that we should stop becoming so panicky when variants arise that are antibody evasive, because there's another arm of the immune system which is sort of holding fast in terms of assisting with the prevention of infection to severe disease.
All right, let's talk about booster shots, right? They're being punted to help fight off Omicron. The UK is actually giving booster shots 3 months after the second Pfizer jab. This, of course, was previously only available after a minimum of 6 months after that second dose. So what's the science behind this earlier introduction? And do you think it should be considered here in South Africa?
It depends what you're trying to achieve. If you're trying to prevent infections, the data from the UK study in fact shows that if you give a third dose of the Pfizer vaccine to people that receive 2 doses of Pfizer or 2 doses of AstraZeneca, the protection against symptomatic infection increases from 30%, 34% to 70% or above 70%. So if you're trying to prevent infection, you're probably worthwhile going for a third dose, but we're not trying to prevent infections in South Africa or in most of the rest of the world, except some high-income countries that have ordered vaccines. What we are trying to prevent is severe disease and death. And when it comes to prevention of severe disease and death, the group that will benefit the most from a third dose of vaccine, and for the Johnson & Johnson vaccine, certainly they should get a Pfizer boost. And I need to be explicit about that based on the data around Omicron as well. Individuals that receive a single dose of the Johnson & Johnson vaccine should get a Pfizer dose as a boost. And the reason there is that by targeting high-risk individuals, we'll be able to improve the protection against severe disease, say from 70% to 80 and 90% with that third dose. So giving it to people above the age of 65, giving it to people with underlying medical conditions that causes their immune systems to be suppressed, those are the groups we need to target, that have already received 2 doses of Pfizer with an additional dose of Pfizer. And as for anyone that receives a single dose of the Johnson & Johnson vaccine, the data are extremely strong that the heterologous approach works better than a homologous approach, which means Johnson & Johnson followed by Pfizer will likely produce much better protection and certainly induces much better immune responses than 2 doses of the Johnson & Johnson vaccine.
All right, thank you so much for your time and your insight. Always a pleasure talking to you, Professor Shabir Madhi, Wits University vaccinologist.